The kidneys play a crucial role in filtering blood and removing harmful waste products from the body. When they start to malfunction, various health issues can arise. Early recognition of kidney disease symptoms is extremely important. The sooner we detect the problem, the greater the chance for effective treatment. In this video, you will learn about the most important warning signs that may indicate kidney problems. This knowledge will help you take appropriate action before it's too late. So, let's find out more about the warning signs our kidneys send us when they start to fail. The first symptom on our list is very distinctive and hard to miss. It involves a metallic taste in the mouth while eating and a characteristic ammonia-like breath odor. This occurs when uremia, a chronic condition related to kidney failure, is on the horizon. As a result, toxic waste products begin to accumulate in the body. This is why there is a characteristic ammonia smell in the mouth, and food starts to taste completely different than before. Notably, in some cases, you may even lose your appetite for certain foods, such as meat. Next, we will focus on chronic fatigue. This condition is usually associated with ailments like anemia or hypothyroidism. However, it can also occur when our kidneys start to fail. How is this possible? The kidneys act as a natural filter for our blood, removing unnecessary waste products from the body. If we slow down or impair this process in any way, these products remain in our blood and slowly poison us. Additionally, the kidneys produce a hormone called erythropoietin. Its main task is to stimulate our body to produce red blood cells, which deliver oxygen to every cell. Therefore, it's no surprise that when something happens to our kidneys, our overall performance decreases, and we lose the strength to do anything. The feeling of fatigue consists of several elements, including lack of energy, difficulty performing daily tasks, trouble concentrating, feelings of sadness, lack of desire to do things we used to enjoy, and even memory deterioration. But there is one more signal that many people associate with fatigue, which I will discuss shortly, so please stay with me until the end. And since I've already mentioned fatigue, it's worth saying a little more about sleep problems. What do unhealthy kidneys have to do with sleep disorders? Well, toxins not removed by the kidneys accumulate in our bodies, causing additional stress, exacerbating inflammation, and often preventing restful sleep, which is essential for recovery. Studies have documented many cases of insomnia among people who have developed chronic kidney disease. When discussing sleep disorders, I would also like to emphasize not to overlook restless leg syndrome, as this condition also contributes to insomnia and kidney diseases. Finally, to conclude the topic of sleep, do not ignore excessive sleepiness and too many naps during the day. If you often feel excessively sleepy during the day, it's time to take care of your health. Another symptom that may suggest our kidneys are calling for help is shortness of breath and shallow breathing. This point may surprise many people because anatomically, the lungs are far from the kidneys, and few see any connection between these two pairs of organs. However, it is very significant. This problem can arise from two factors. Firstly, a low level of red blood cells which do not deliver enough oxygen to our organs. And secondly, when our kidneys start to function poorly, the excess fluids they cannot remove begin to accumulate in the lungs. Interestingly, some studies provide evidence that this may also result from inflammation occurring in the bodies of people with kidney diseases, which simply damages the delicate lining of the lungs. Let's move on. Do you often feel an irresistible urge to scratch? Not just superficially, but a very persistent need that is sometimes hard to endure. Be very alert to such a situation, as it may be a symptom of kidney disease. Firstly, when the kidneys are failing, there is an irresistible need to scratch because waste metabolites are not removed from the bloodstream. The second problem in this case is that kidney diseases are often accompanied by bone mineralization issues. This, in turn, results from an imbalance of minerals and nutrients in your body, affecting the hydration of your skin. The drier it is, the more often you will scratch. A common condition that reveals unhealthy kidneys is also blisters and unsightly dermatological changes. In the worst case, calcium deposits may begin to accumulate under the skin, and nails may change color, becoming half white and half red. And since we're already talking about nails, it's also worth considering how kidney failure affects the appearance of our hands and feet, as this is also characteristic of people with these conditions. Why? Because the kidneys regulate fluid levels in our bodies. Without them, we would not be able to remove many unwanted substances from our bodies. This is why one of the signs that the kidneys are starting to fail is swelling of our hands and feet, which occurs due to water retention in our bodies. Of course, please remember that this can also indicate many other conditions. So if you notice such changes, it is worth consulting a doctor. Another area where swelling may occur when our kidneys are unhealthy is our face. This problem can be somewhat harder to notice because facial swelling is associated with many different conditions, even appearing when we sleep on our stomachs for too long. It can also accompany conditions such as diabetes or hypothyroidism, but it should not be ignored, as it is just as often a result of deteriorating kidney function. However, there is another symptom that suggests we are on the right track by suspecting kidney issues, namely dark circles under the eyes. The skin in this area is very thin, making this symptom easy to notice. Therefore, it is worth keeping in mind that eyelid swelling, conjunctival pallor, degenerative changes, and corneal calcification intensify as kidney disease progresses. In the next point, we will focus on hypertension. This condition is essentially considered a lifestyle disease, as a large percentage of the population experiences it at some stage in their lives. While it can result from a range of conditions, many of you might think of diabetes or cardiovascular diseases, and yes, I agree, that's accurate. Few people are aware of the role our kidneys play in regulating blood pressure. In this case, it works somewhat like a double-edged sword because, on one hand, hypertension leads to the development of kidney disease, but also, looking the other way, unhealthy kidneys cause what is known in professional terminology as renal hypertension. When this organ is exposed to reduced blood flow, it reacts as if it is dealing with dehydration and releases hormones that stimulate the entire body to retain sodium and water. Then, the blood vessels fill with additional fluid, the pressure rises, and the problem is set. And since we mentioned kidneys, which produce urine, let's talk about blood in the urine. This symptom is rather hard to miss because, in this case, urine changes its color from straw-like to a distinctive red. A healthy pair of kidneys does an excellent job of filtering blood in the glomeruli, but unfortunately, when this process becomes inefficient, red blood cells sneak into our urine. This signal can not only indicate problems with the basic filtration function of diseased kidneys, but can also often suggest kidney stones, tumors, or even infections. If you want to learn more about what the color of our urine can tell us, stay with me until the end. Now let's move on to another symptom that may indicate our kidneys are not doing well. A somewhat less alarming symptom, but one that is easy to overlook, is changes in the frequency of urination. Well-functioning kidneys produce urine almost like clockwork, of course, under the very important condition that you are providing your body with an adequate amount of fluids. However, when this process is disrupted to some extent, it can lead to either increased frequency of urination or a feeling of urgency when the kidneys produce too little urine. This can also result in a feeling of incomplete bladder emptying, causing us to return to the bathroom several times after leaving it. But that's not all, as this doesn't only concern changes in daytime urination frequency. You may also start waking up several times at night just to go to the bathroom. In addition to changes in urination frequency, it's important to be aware of how the urine stream looks, as we can also notice some warning signs here. I will talk about the color of urine and how it should look daily in just a moment. But now, I want to alert you to the appearance of characteristic foam, or even large bubbles on the surface of the urine. This foam indicates that the kidneys are not filtering the blood well, and protein is getting into the urine, which reduces the surface tension of the water, causing it to foam. Now that we've discussed symptoms that may indicate kidney disease, let's share some interesting information about them, and start with how to check if we have kidney disease. If you notice one or more concerning symptoms, it's worth at least undergoing basic laboratory tests, preferably after consulting a nephrologist. What does kidney disease diagnosis look like? After a medical interview, a general urine test is recommended, which allows for quantitative and qualitative assessment of elements such as leukocytes and erythrocytes. It will also reveal whether we are dealing with proteinuria and provide information on its color, pH, and clarity. Another diagnostic test is the glomerular filtration rate, eGFR, along with parameters concerning electrolytes such as potassium, sodium, chloride, calcium, inorganic phosphorus, uric acid levels, urea, and albumin and creatinine levels. Additionally, there is an option to measure albumin concentration in a 24-hour urine collection and creatinine clearance. Next question: what does our urine look like when we have kidney disease? The ability to assess the appearance of urine is very important because it allows for a quick reaction when something undesirable occurs. The normal appearance of urine is a clear liquid with a straw yellow color and a slight ammonia smell. Of course, it's worth considering that the smell and color are much more intense in the morning due to its higher concentration overnight. Colors that should concern you include orange or green, as they may indicate the presence of bilirubin in the urine. Red may indicate blood in the urine. Brown could be a sign of jaundice or pancreatic cancer. Colors that resemble more of a rainbow than physiological urine, such as blue, are a sign of bacterial infection. And the last question: how to recognize that pain originates in the kidneys? This pain usually affects the lumbar area and often appears only on one side. It can also radiate to the groin, abdomen, and pelvis. However, it's important to remember that kidney pain rarely occurs without any additional symptoms. So if, in addition to the discomfort I just described, you experience nausea or fever, don't delay and see a specialist as soon as possible. Thank you for joining me today as we explored the important signs of kidney health. Remember, being aware of these symptoms can make a significant difference in early detection and treatment. If you have any concerns, don't hesitate to consult a healthcare professional. Stay informed, take care of your health, and I look forward to seeing you in the next episode. Until then, take care and stay healthy.